Get ready to test your knowledge and sharpen your skills with these 20 high-yield NCLEX-style questions on nursing fundamentals. Each question is designed to challenge your critical thinking, reinforce essential concepts, and help you feel more confident for test day. Let's dive in and see how many you can get right. Good luck. A nurse is caring for a patient with severe burns covering 40% of the body surface area. The patient is receiving intravenous fluids based on the Parkland formula. The nurse should prioritize which of the following in the first 24 hours of fluid resuscitation? A. Monitor urine output closely to ensure it is 30 to 50 milliliters per hour. B. Administer pain medications to alleviate the patient's discomfort. C. Keep the patient in a supine position to promote fluid distribution. D. Offer small, frequent meals to maintain nutritional balance. The correct answer is A. Monitor urine output closely to ensure it is 30 to 50 milliliters per hour. The rationale is that monitoring urine output is crucial for assessing the effectiveness of fluid resuscitation and kidney function in patients with burns. The target output is 30 to 50 milliliters per hour to maintain adequate renal perfusion. Incorrect answers. B. Administer pain medications to alleviate the patient's discomfort. Pain management is essential, but fluid resuscitation and renal function are more urgent in the first 24 hours. C. Keep the patient in a supine position to promote fluid distribution. The patient should be positioned to prevent pressure sores and maintain proper circulation, but fluid resuscitation monitoring takes priority. D. Offer small, frequent meals to maintain nutritional balance. Nutritional needs are important, but are secondary to fluid and renal management during the initial burn phase. CliniqueRN test day tip. Always prioritize assessments that directly affect vital organ function. Example, kidneys, during fluid resuscitation in critically ill patients, particularly those with burns. Question 2. A nurse is caring for a patient with diabetes mellitus who is admitted for diabetic ketoacidosis, DKA. The patient is receiving an IV insulin infusion. What is the nurse's priority action when the patient's blood glucose level decreases to 250 milligrams per deciliter? A. Continue the IV insulin infusion without changes. B. Administer a 25% dextrose solution to prevent hypoglycemia. C. Notify the healthcare provider of the blood glucose change. D. Increase the insulin rate to lower the blood glucose faster. The correct answer is B. Administer a 25% dextrose solution to prevent hypoglycemia. Rationale: when the blood glucose level drops below 250 milligrams per deciliter during DKA treatment, the nurse must administer a dextrose solution to prevent hypoglycemia while continuing insulin therapy to resolve the acidosis. Rationale for incorrect answers. A. Continue the IV insulin infusion without changes. Continuing the insulin infusion without adjusting or providing glucose could cause hypoglycemia. C. Notify the healthcare provider of the blood glucose change. The provider should be notified, but the priority action is to prevent hypoglycemia. D. Increase the IV insulin rate to lower the blood glucose faster. Increasing the insulin rate without administering glucose could result in a dangerous drop in blood sugar. CliniqueRN test day tip. In DKA, closely monitor blood glucose levels and adjust treatment promptly to avoid the risks of both hyperglycemia and hypoglycemia. Always maintain a balance. Question 3. A nurse is caring for a patient who has just undergone a mastectomy. The nurse notices that the patient has a JP drain in place and the drainage has increased in volume. What is the nurse's priority action? A. Empty the drain and record the amount of drainage. B. Notify the healthcare provider immediately. C. Assess the incision site for signs of infection. D. Position the patient in a sitting position to promote drainage. The correct answer is A. Empty the drain and record the amount of drainage. Rationale: it is essential to monitor drainage and empty the drain as prescribed to prevent fluid accumulation and maintain suction. Rationale for incorrect answers. B. Notify the healthcare provider immediately. While this may be necessary if there are significant changes in drainage, the first step is to empty and assess the amount of drainage. C. Assess the incision site for signs of infection. Infection is a concern, but addressing drainage accumulation is the immediate priority. D. Position the patient in a sitting position to promote drainage. Proper positioning may assist with drainage, but the primary action is to manage the drain and assess the amount. CliniqueRN Test Day Tip. Postoperative management of drains involves regular monitoring and proper documentation of drainage volume. It's essential to follow protocols to prevent complications such as hematoma or infection. Question 4. A nurse is caring for a patient who is receiving warfarin therapy. The nurse notes that the patient's INR is 4.5. What is the nurse's priority intervention? A. Administer the warfarin dose as prescribed. B. Monitor the patient for signs of bleeding. C. Increase the patient's vitamin K intake to reverse the effects. D. Withhold the warfarin and notify the healthcare provider. The correct answer is D. Withhold the warfarin and notify the healthcare provider. Rationale for correct answer. An INR of 4.5 is above the therapeutic range, placing the patient at risk for bleeding. The nurse should withhold the warfarin and notify the healthcare provider to determine if any interventions are needed, such as vitamin K administration. Rationale for incorrect answers. A. Administer the warfarin dose as prescribed. Administering warfarin with an elevated INR would further increase the risk of bleeding. B. Monitor the patient for signs of bleeding. While bleeding signs are important to monitor, the immediate action is to hold the medication and notify the healthcare provider. C. Increase the patient's vitamin K intake to reverse the effects. Vitamin K may be necessary, but the healthcare provider should be consulted first to determine the appropriate course of action. CliniqueRN Test Day Tip. Always monitor INR levels closely in patients on warfarin. If the INR is elevated, take immediate action by withholding the dose and consulting the healthcare provider for further management. Question 5. A nurse is caring for a patient who is receiving intravenous potassium chloride. The patient begins to complain of burning and pain at the infusion site. What is the nurse's priority action? A. Slow the rate of the infusion. B. Discontinue the infusion and notify the healthcare provider. C. Administer pain medication as prescribed. D. Apply a warm compress to the infusion site. The answer is B. Discontinue the infusion and notify the healthcare provider. Rationale: potassium chloride is an irritant to veins, and pain or burning at the infusion site may indicate infiltration or thrombophlebitis. The infusion should be stopped, and the healthcare provider should be notified for further action. Rationale for incorrect answers. A. Slow the rate of the infusion. Slowing the infusion does not address the underlying cause of the pain or prevent further injury. C. Administer pain medication as prescribed. Pain medication may be needed, but the priority is to stop the potassium infusion to prevent further tissue damage. D. Apply a warm compress to the infusion site. A warm compress may provide temporary relief, but the priority is to discontinue the infusion and notify the healthcare provider. CliniqueRN Test Day Tip. When administering potassium intravenously, monitor closely for signs of irritation or infiltration. If pain occurs, immediately stop the infusion and assess the site to prevent complications. Question 6. A nurse is caring for a patient who has a history of hypertension and is prescribed a calcium channel blocker. The nurse notes that the patient's blood pressure is 90/60 mmHg. What is the nurse's priority action? A. Administer the medication as prescribed. B. Notify the healthcare provider and hold the medication. C. Recheck the blood pressure in 30 minutes. D. Increase the IV fluids to raise the blood pressure. The correct answer is B. Notify the healthcare provider and hold the medication. Rationale for correct answer. A blood pressure of 90/60 mmHg is low, and calcium channel blockers can further lower blood pressure. The nurse should hold the medication and notify the healthcare provider to prevent hypotension. Rationale for incorrect answers. A. Administer the medication as prescribed. Administering the medication could further lower the patient's blood pressure. C. Recheck the blood pressure in 30 minutes. Rechecking the blood pressure is important, but the priority is to withhold the medication and consult the healthcare provider. D. Increase the IV fluids to raise the blood pressure. For fluids may help, but withholding the medication is the first step in preventing further hypotension. CliniqueRN Test Day Tip. When caring for patients on antihypertensive medications, always assess blood pressure before administration. If the blood pressure is low, hold the dose and consult the healthcare provider for further guidance. Question 7. A nurse is caring for a patient with chronic obstructive pulmonary disease, COPD, who is receiving oxygen therapy. The nurse notes that the patient's respiratory rate is 24 breaths per minute, and the oxygen saturation is 88%. What is the nurse's priority action? A. Increase the oxygen flow rate to 4 liters per minute. B. Notify the healthcare provider about the low oxygen saturation. C. Administer a bronchodilator as prescribed. D. Encourage the patient to take deep breaths and cough. The correct answer, C. Administer a bronchodilator as prescribed. Rationale for correct answer. In COPD, oxygen saturation can be low due to airway obstruction. A bronchodilator is the first-line treatment to open the airways and improve oxygenation. Incorrect answers. A. Increase the oxygen flow rate to 4 liters per minute. Increasing the oxygen flow rate without addressing the underlying airway obstruction may not be effective. B. Notify the healthcare provider about the low oxygen saturation. Notification may be necessary, but the priority action is to administer a bronchodilator to address the cause of low oxygen saturation. D. Encourage the patient to take deep breaths and cough. While deep breathing is important, it is not sufficient to address the underlying obstruction in this patient with COPD. CliniqueRN Test Day Tip. In COPD patients, always prioritize bronchodilator administration to open the airways. Oxygen therapy should be carefully titrated to prevent complications like CO2 retention. Question 8. A nurse is caring for a patient receiving digoxin. The patient's serum potassium level is 2.8 milliequivalent/L. What is the nurse's priority action? A. Administer the digoxin dose as prescribed. B. Administer potassium supplements as prescribed. C. Hold the digoxin dose and notify the healthcare provider. D. Increase the digoxin dose to compensate for low potassium levels. The answer is C. Hold the digoxin dose and notify the healthcare provider. Rationale: hypokalemia, low potassium, increases the risk of digoxin toxicity. The nurse should hold the digoxin dose and notify the healthcare provider for further evaluation. Incorrect answers. A. Administer the digoxin dose as prescribed. Administering digoxin in the presence of hypokalemia can exacerbate the risk of toxicity and arrhythmias. B. Administer potassium supplements as prescribed. While potassium supplementation may be necessary, the first action is to hold digoxin and notify the provider. D. Increase the digoxin dose to compensate for low potassium levels. Increasing the dose of digoxin would increase the risk of toxicity, which is dangerous, especially with low potassium levels. CliniqueRN Test Day Tip. Always assess electrolyte levels before administering digoxin. Low potassium levels significantly increase the risk of digoxin toxicity and arrhythmias. Question 9. A nurse is caring for a patient with end-stage renal disease, ESRD, who is on hemodialysis. The patient reports feeling dizzy, weak, and nauseous after the dialysis session. What is the nurse's priority action? A. Administer the prescribed antiemetic medication. B. Monitor the patient's blood pressure and heart rate. C. Offer the patient a snack to relieve dizziness. D. Notify the healthcare provider about the patient's symptoms. The correct answer is B. Monitor the patient's blood pressure and heart rate. Rationale for correct answer. Dizziness, weakness, and nausea following dialysis are common symptoms of hypotension or fluid shifts. The nurse should first monitor vital signs, particularly blood pressure, to assess for post-dialysis hypotension. Rationale for incorrect answers. A. Administer the prescribed antiemetic medication. Administering antiemetics may be necessary, but should be done after assessing for hypotension, which is the most common cause of these symptoms. C. Offer the patient a snack to relieve dizziness. Offering food may help if the patient is hypoglycemic, but the priority is to assess for hypotension or other issues. D. Notify the healthcare provider about the patient's symptoms. The healthcare provider should be notified if hypotension is confirmed, but the priority is to assess the patient's vital signs. CliniqueRN Test Day Tip. Post-dialysis hypotension is a common cause of dizziness and nausea. Always assess vital signs and fluid status in patients after dialysis to guide appropriate interventions. Question 10. A nurse is preparing to administer oral prednisone to a patient with an autoimmune disease. The nurse should provide the patient with which of the following instructions? A. Take the medication on an empty stomach for better absorption. B. Increase your intake of salt to compensate for sodium loss. C. Avoid taking the medication with antacids, as it will reduce the effect. D. Take the medication with food to minimize gastrointestinal irritation. The correct answer is D. Take the medication with food to minimize gastrointestinal irritation. Rationale for correct answer. Oral prednisone should be taken with food to prevent gastrointestinal irritation and ulcers. Rationale for incorrect answers. A. Take the medication on an empty stomach for better absorption. Taking prednisone on an empty stomach can cause gastrointestinal distress. B. Increase your intake of salt to compensate for sodium loss. Prednisone can cause fluid retention and increase sodium levels, not decrease them, so additional salt is not needed. C. Avoid taking the medication with antacids, as it will reduce the effect. Antacids may interfere with prednisone absorption, but the primary concern is taking prednisone with food, not antacids. CliniqueRN Test Day Tip. Always educate patients about taking corticosteroids like prednisone with food to avoid gastrointestinal upset. Long-term corticosteroid use requires monitoring for side effects like fluid retention and glucose intolerance. Question 11. A nurse is caring for a patient with chronic heart failure, CHF, who has been prescribed a diuretic. The nurse notes that the patient's potassium level is 3.0 milliequivalent per liter. What is the nurse's priority action? A. Administer the diuretic as prescribed. B. Notify the healthcare provider and prepare to administer potassium supplements. C. Assess the patient's vital signs, particularly blood pressure. D. Withhold the diuretic and notify the healthcare provider. The correct answer is B. Notify the healthcare provider and prepare to administer potassium supplements. Rationale for correct answer. A potassium level of 3.0 milliequivalent per liter is low, and the patient may be at risk for arrhythmias due to hypokalemia, especially with the use of diuretics. The priority is to notify the provider and consider potassium supplementation. Rationale for incorrect answers. A. Administer the diuretic as prescribed. Administering the diuretic could worsen hypokalemia and increase the risk of complications. C. Assess the patient's vital signs, particularly blood pressure. While vital signs should be monitored, the priority is addressing the low potassium level. D. Withhold the diuretic and notify the healthcare provider. Withholding the diuretic may be appropriate if instructed by the provider, but the priority is ensuring the patient receives appropriate potassium supplementation. CliniqueRN Test Day Tip. Always monitor potassium levels in patients receiving diuretics. Hypokalemia can lead to dangerous cardiac arrhythmias, so potassium levels should be corrected promptly. Question 12. A nurse is caring for a patient who is receiving warfarin therapy and has a therapeutic INR of 2.8. The patient begins to experience spontaneous bruising and hematomas. What is the nurse's priority intervention? A. Continue warfarin therapy and monitor the bruising. B. Notify the healthcare provider and withhold the warfarin dose. C. Administer vitamin K as prescribed to reverse the effects of warfarin. D. Encourage the patient to wear compression stockings to prevent further bruising. The correct answer is B. Notify the healthcare provider and withhold the warfarin dose. Rationale for correct answer. Spontaneous bruising and hematomas are signs of excessive anticoagulation. Although the INR is within the therapeutic range, the nurse should withhold the warfarin and notify the healthcare provider for further evaluation and potential dose adjustment. Rationale for incorrect answers. A. Continue warfarin therapy and monitor the bruising. Continuing warfarin could increase the risk of severe bleeding. The healthcare provider should be notified to evaluate the need for dose adjustment. C. Administer vitamin K as prescribed to reverse the effects of warfarin. Vitamin K administration should only be used if the INR is critically elevated or the patient is actively bleeding. D. Encourage the patient to wear compression stockings to prevent further bruising. Compression stockings are not appropriate for managing bruising caused by anticoagulant therapy. The focus should be on adjusting the anticoagulant therapy. CliniqueRN Test Day Tip. Monitor for signs of bleeding in patients on anticoagulant therapy. When bruising or bleeding occurs, promptly assess the INR and consult with the healthcare provider to determine whether to hold the medication or adjust the dose. Question 13. A nurse is caring for a patient who has just undergone a laparoscopic cholecystectomy. The patient is complaining of shoulder pain, which is a common post-operative symptom. What is the nurse's priority intervention? A. Administer pain medication as prescribed. B. Encourage the patient to ambulate to reduce the pain. C. Instruct the patient to breathe deeply to relieve shoulder pain. D. Apply a warm compress to the shoulder area. The correct answer. A. Administer pain medication as prescribed. Rationale for correct answer. Shoulder pain following laparoscopic surgery is often referred pain from the carbon dioxide used in the procedure. The first priority is managing the patient's pain, which can help improve their comfort and recovery. Rationale for incorrect answers. B. Encourage the patient to ambulate to reduce the pain. Ambulation is important for recovery, but may not immediately relieve the referred shoulder pain. C. Instruct the patient to breathe deeply to relieve shoulder pain. While deep breathing is beneficial for overall recovery, it will not directly relieve shoulder pain from the procedure. D. Apply a warm compress to the shoulder area. Warm compresses may help with some discomfort, but are not as effective as pain management. CliniqueRN Test Day Tip. After laparoscopic surgery, expect referred pain from the CO2 used during the procedure. Pain relief should be prioritized to ensure patient comfort and prevent complications like shallow breathing due to discomfort. Question 14. A nurse is caring for a patient who is receiving heparin therapy for deep vein thrombosis, DVT. The nurse notes that the patient's APTT is 80 seconds, therapeutic range, 60 to 80 seconds. What should the nurse do? A. Continue the heparin infusion without changes. B. Increase the heparin infusion rate. C. Decrease the heparin infusion rate. D. Discontinue the heparin infusion immediately. The correct answer is A. Continue the heparin infusion without changes. Rationale for correct answer. The patient's APTT of 80 seconds is within the therapeutic range for heparin therapy. The nurse should continue the infusion without adjustments. Rationale for incorrect answers. B. Increase the heparin infusion rate. Increasing the infusion rate could lead to bleeding complications since the patient's APTT is already within the target range. C. Decrease the heparin infusion rate. Decreasing the infusion rate is unnecessary, as the APTT is already in the therapeutic range. D. Discontinue the heparin infusion immediately. Discontinuing the infusion would disrupt anticoagulation therapy, which could lead to complications such as clot formation. CliniqueRN Test A tip. Always monitor APTT levels when administering heparin. If the level is within the therapeutic range, no adjustments to the infusion are necessary. Monitor for signs of bleeding to ensure safety. Question 15. A nurse is caring for a patient with a new diagnosis of multiple sclerosis, MS. The patient is asking about lifestyle changes that may help manage the disease. What is the nurse's best response? A. You should limit your physical activity to avoid fatigue. B. It's important to stay active with a regular exercise program. C. You should avoid any form of exercise to prevent worsening your symptoms. D. You should plan to stay indoors and avoid heat to prevent flare-ups. The correct answer is B. It's important to stay active with a regular exercise program. Rationale for correct answer. Regular exercise helps to improve strength, flexibility, and overall functioning in patients with multiple sclerosis, despite the presence of fatigue. Rationale. A. You should limit your physical activity to avoid fatigue. Limiting physical activity can lead to muscle weakness and further complications. Regular, moderate exercise is beneficial. C. You should avoid any form of exercise to prevent worsening your symptoms. Exercise is encouraged to improve mobility and reduce fatigue. Avoiding it could lead to further deconditioning. D. You should plan to stay indoors and avoid heat to prevent flare-ups. While heat sensitivity is common, patients are encouraged to maintain physical activity, and avoiding heat is only necessary if it exacerbates symptoms. CliniqueRN Test A tip. Promote a balanced lifestyle for patients with MS that includes regular physical activity and strategies to manage fatigue. Always consider the patient's individual tolerance and energy levels. Question 16. A nurse is caring for a patient with a history of alcohol abuse who has been admitted for alcohol withdrawal. The nurse notes that the patient is becoming increasingly agitated and tremulous. What is the nurse's priority action? A. Administer a benzodiazepine as prescribed. B. Reassure the patient and allow them to rest. C. Offer the patient fluids and snacks to help with hydration. D. Perform a complete physical examination to rule out other causes of agitation. The correct answer is A. Administer a benzodiazepine as prescribed. Rationale for correct answer. Alcohol withdrawal can lead to agitation, tremors, and seizures. Benzodiazepines are used to manage withdrawal symptoms and prevent complications such as seizures. Rationale for incorrect answers. B. Reassure the patient and allow them to rest. Reassurance is important, but benzodiazepines are needed to address the physical symptoms of alcohol withdrawal. C. Offer the patient fluids and snacks to help with hydration. While hydration is important, medication to control withdrawal symptoms is the priority. D. Perform a complete physical examination to rule out other causes of agitation. The nurse should assess for other causes, but should focus on managing withdrawal symptoms as a priority. CliniqueRN Test A tip. Alcohol withdrawal can be life-threatening. Administer prescribed medications like benzodiazepines to manage symptoms and prevent complications, such as seizures. Question 17. A nurse is caring for a patient who is receiving chemotherapy for breast cancer. The patient reports feeling nauseous and requests medication to help with the symptoms. What is the nurse's priority action? A. Administer the prescribed antiemetic medication. B. Offer the patient fluids to hydrate and reduce nausea. C. Encourage the patient to take deep breaths to relieve nausea. D. Suggest eating small, frequent meals to reduce discomfort. The correct answer is A. Administer the prescribed antiemetic medication. Rationale for correct answer. Chemotherapy-induced nausea and vomiting can be severe, and administering the prescribed antiemetic medication is the priority to manage symptoms. Rationale for incorrect answers. B. Offer the patient fluids to hydrate and reduce nausea. Hydration is important, but should follow the administration of antiemetics. C. Encourage the patient to take deep breaths to relieve nausea. Deep breathing may help reduce anxiety, but antiemetics are the most effective way to manage chemotherapy-induced nausea. D. Suggest eating small, frequent meals to reduce discomfort. While eating strategies can help, antiemetic medications are more effective for nausea control. CliniqueRN Test Day Tip. Always address nausea and vomiting promptly in patients receiving chemotherapy. Anti-nausea medications are essential for maintaining comfort and preventing dehydration. Question 18. A nurse is caring for a patient with chronic renal failure who is receiving hemodialysis. The patient complains of feeling weak and nauseous during the procedure. What is the nurse's priority intervention? A. Stop the dialysis treatment immediately. B. Administer the prescribed antiemetic medication. C. Check the patient's blood pressure and heart rate. D. Offer the patient a snack to alleviate the nausea. The correct answer is C. Check the patient's blood pressure and heart rate. Rationale. Feeling weak and nauseous during hemodialysis is often related to hypotension due to the fluid removal process. The nurse should check the blood pressure and heart rate to assess for signs of hypotension. Incorrect answers. A. Stop the dialysis treatment immediately. Stopping dialysis should not be done unless necessary. Assessing the patient's vitals is the priority. B. Administer the prescribed antiemetic medication. While antiemetics may be necessary, checking vital signs is the immediate priority to address the possible cause of symptoms. D. Offer the patient a snack to alleviate the nausea. Offering a snack is not appropriate during dialysis and should not take priority over monitoring vital signs. CliniqueRN Test Day Tip. Monitor vital signs during hemodialysis, especially for hypotension. Addressing fluid shifts and ensuring proper management can prevent complications like nausea and weakness. Question 19. A nurse is caring for a patient who has just been diagnosed with type 1 diabetes mellitus. The patient is learning how to administer insulin. What is the nurse's priority teaching point? A. You should rotate the injection sites to avoid tissue damage. B. You should take your insulin immediately after eating. C. You should store your insulin at room temperature for easy access. D. You should avoid checking your blood sugar frequently to prevent anxiety. The correct answer is A. You should rotate the injection sites to avoid tissue damage. Rationale for correct answer. Rotating injection sites helps prevent lipodystrophy, fat tissue damage, and ensures more consistent absorption of insulin. Rationale for incorrect answers. B. You should take your insulin immediately after eating. Insulin should be administered before meals to allow it to begin working as glucose from the meal enters the bloodstream. C. You should store your insulin at room temperature for easy access. Insulin should be stored according to manufacturer guidelines, typically in the refrigerator to preserve its effectiveness. D. You should avoid checking your blood sugar frequently to prevent anxiety. Regular blood glucose monitoring is essential to managing diabetes effectively. CliniqueRN Test Day Tip. Teach patients with diabetes proper techniques for insulin administration, including site rotation and timing of injections, to ensure effective glucose control and prevent complications. Question 20. A nurse is caring for a patient with a newly inserted central venous catheter, CVC. The nurse should assess for which of the following complications may occur during the first 24 hours. A. Pneumothorax. B. Hypertension. C. Hyperglycemia. D. Hypokalemia. The correct answer is A. Pneumothorax. Rationale for correct answer. A pneumothorax is a potential complication following the insertion of a central venous catheter due to the risk of puncturing the lung. It is important to assess for signs of respiratory distress or decreased breath sounds. Incorrect answers. B. Hypertension. Hypertension is not a direct complication of CVC insertion. C. Hyperglycemia. While hyperglycemia can occur in critically ill patients, it is not a primary concern related to CVC insertion. D. Hypokalemia. Hypokalemia may result from other causes but is not directly associated with CVC insertion. CliniqueRN Test Day Tip. Be vigilant for respiratory complications like pneumothorax after central line insertion. Early recognition and intervention can prevent serious consequences. Great job working through those questions. If you found this helpful, don't forget to like the video and subscribe to our channel for more NCLEX tips and practice questions. And for even more free resources, expert strategies, and full question banks, sign up at CliniqueRN.com. It's free.